So oftentimes what they might do in exercise testing with people with asthma, just get them on a single stage. So get them to a fairly high intensity for 6 to 8 minutes, 65 to 75% VO2 max or heart rate reserve. So that's going to be sort of a running pace, light run. Do the pulmonary function testing, the forced vital capacity and the FEV1 before and after exercise, and that people will need to avoid their medications for, before the test, no exercise for 12 hours, and then usually no caffeine as well, because as we mentioned, theophylline bronchodilator is similar to caffeine. That is going to affect the test. So switching gears a little bit to pulmonary rehab, and what does pulmonary rehab do? So just like cardiac rehab, people can be referred to pulmonary rehab if they've got COPD or other types of lung diseases, cystic fibrosis, pulmonary fibrosis, possibly even lung cancer, but most of the times you're going to see people with COPD. And so these are typically done in hospital settings or other type of medically supervised facilities on an outpatient basis. So to get people to participate, again, we can't really do too much, with the lung itself, but can we improve their overall function and can we improve their functional capacity? So they get, as a result of being inactive, they're going to decrease their aerobic enzymes, they're going to decrease their type 1 muscle fibers, their aerobic fibers, capillary density is going to go down, they're going to have more inflammation, they're going to have more cell death, they're going to have increased acidosis from all that CO2 being in their lungs. Remember, they're unable to get the CO2 out of their lungs. That's actually going to lower their pH and increase their acidosis. And they're typically not going to feel very well. People need to be able to be ambulatory, and they need to also have the cognitive function to be able to take direction and participate in the programs. So what they usually will do in these programs is we'll have these people do a lot of walking or cycling type exercise on the cardio equipment. They'll do a higher intensity exercise, but it's going to be a lot of work and rest, interval type of exercise. So what would normally take a person an hour to do might take them 3 hours because they have to do so many rest breaks. So they can do an exercise time, then they're going to have to sit and rest. And you can see these sessions might last 3 times a week for 6 to 12 weeks. They'll also do resistance training, which is important because if they can improve their muscle strength and their muscle endurance, that's going to take a little bit of stress off their lungs. So the better their strength, the better the muscle endurance, they don't have to worry so much about their cardiorespiratory endurance. People may be on medications, they may be using their bronchodilators before exercise, and the people who have severe COPD may also be on supplemental oxygen. So you can see all these things that pulmonary rehab does. It improves their muscle function, it is going to reduce their dyspnea, it's going to make them feel a little bit better. They don't feel like they're short of breath. It's going to reduce their anxiety and depression. Obviously, having a disease like COPD is very scary and a lot of anxiety producing, medical costs. Reduces the hyperinflation of the lungs, and it also helps them with their other health behaviors. So if they're regular with exercise, they're going to be probably a little bit better with diet. We obviously we want to get people, if they're still using any type of tobacco products, to get them to smoke, so to keep them, current with their tobacco cessation.